Hi, today I'm joined by Joel Fuentes. He's a medical provider, and we are going to talk about a very important topic, which is vitamin D. And I will have Joel introduce himself and give us a little bit of history of what he's done and his experience. So take it away.
Well, first of all, thank you, Xochitl, for having me here on your program. This is a very important topic. We're going to talk about vitamin D. I'm a medical provider of more than 15 years, working with the Hispanic community. And yes, it's very important to talk about this topic because of the times that we're going through with the COVID.
Very, very true. So Joel is going to share quite a few very useful information as to why vitamin D is so important, especially right now. A lot of this information hasn't necessarily been out on the mainstream. So it's important to us to be able to get this message out and to help you guys and your families establish, a healthier immune system to fight off many illnesses and or diseases that, we constantly fight on a daily basis, right? And I will link Joel's information to his channel as well, as he will have further information or delve into some of these topics in more detail, so you can follow him as well. So let's get to the nitty-gritty of this topic. And so what is vitamin D?
Well, first of all, it's not even a vitamin. For many years, we thought that vitamin D was an actual vitamin, but it's actually a pre and pro hormone. Necessary, crucial actually for many processes in the body and the production of most of our hormones. So that's why it's so important, especially when we talk about immune health. Vitamin D has been linked to many illnesses, viral illnesses, bacterial illnesses, and even cancer when your vitamin D levels are low.
Okay.
So that's why it's very important.
That's very interesting to hear, because I don't think a lot of people know that and or associate it with it being a pre-hormone.
Correct. And unfortunately, we weren't even taught this in school. I mean, they didn't really put emphasis on this. So this is why I think just now we're starting to hear more about vitamin D and the importance for our health, overall health.
Well, as a patient, I really appreciate you as a medical provider being able to enlighten us and share information that, we continuously take it upon ourselves to research more. And, because as you said, sometimes we don't learn about this in school. And so I do appreciate that you've taken the time, one, to be here with us, and then, but two, to really gather the information as to why vitamin D is, or pre-hormone vitamin D is important for us.
Correct. Now let me jump in there real quick. And this is why it is crucial right now during this COVID times. It has been shown that if your vitamin D is 20 nanograms per milliliter or less, you're 10 times more likely to have a bad outcome with the virus, including death. And if your vitamin D 30 nanograms per milliliter or more, you're 10 times less likely to have an adverse outcome with respect to this virus.
So I read upon this, and I saw that probably the ideal place we want to be as far as those levels is between 40 and 60.
That's about the sweet spot. Anywhere from 40, even up to 75 is still fine.
Very good.
So, and unfortunately, we're not anywhere near that. More than half the population is deficient and low in vitamin D.
Well, and then we've been asked to stay home, right? This entire year and a half.
That's another important, crucial topic.
We live in Arizona, so we're very fortunate that we get sun just about all year long, right? But for those states or countries, depending on where you're, viewing us from, those with limited amount of sunshine, this is where we would want the higher recommended, right?
Recommended as far as supplement, because we're not going to get it through the sun.
But and you'll go into depth right now as to how long we should be out in the sun, right? But if you want to go back to the importance of that vitamin D.
Well, again, like I said, it's very crucial for many processes in the body. And let's get to that talk about the sun. This is why I think we're very deficient, because we've been avoiding the sun for years. We've been told that the sun's bad for us, that it causes cancer, and
wear your sunscreen, long sleeve.
Wear your sunscreen, long sleeve, and that's not entirely correct.
Right.
Vitamin D is the best. The sun is the best way to get the vitamin D. The UVB rays go through your skin, interact with cholesterol in your skin, and convert it into vitamin D3.
Okay.
And just sitting 20 minutes with good sunlight, you can get anywhere you can get up to 20,000 international units of vitamin D in just those 20 minutes.
And so for people that have darker skin, you do recommend to be out a little longer?
Yes, the melanin on the skin blocks that UVB, and you have to spend more time in the sun, sometimes up to 10 times more, just to get that vitamin D. Now, I don't recommend that you go out there and get burn.
Right.
That's not healthy. But you have to be out there in the sun a little longer if you have darker skin.
So maybe as soon as we start seeing a little bit of that pink, that's kind of when our body's telling us.
Yes, our body will tell us. We'll feel a little bit of that, that little discomfort. That's your body saying, you got enough vitamin D, let's get back inside.
Okay, and so for those that may be afraid of spending the whole 20-30 minutes at once, they could break it up.
Sure, absolutely. You don't have to spend
twice
the
a
whole 20
day
minutes.
or something like that. Okay.
Just the important thing here is just get your sunlight. That's the best way to get vitamin D.
Okay, so perfect. You've answered where we get it, but if there is no sun, where's our other options?
Correct. The other option would be getting it through your foods. The problem is we're not eating the proper foods to get the vitamin D, and the best way to get vitamin D is through fish or any type of shellfish, and through eggs, but the yolks. We've been told it's bad for cholesterol, and I'll make a video about this and explain how crucial cholesterol actually is. So if you can't get it through those foods, if you're allergic to eggs or fish, it's unfortunate, but if you are, you can also get it through vitamin D supplement. Now it has to be vitamin D3. That's the correct. It's more of a storage form, but it's the best. The active, yeah.
Okay, but so is the sun, right? It's the active form that our body's able to process, right? Like intake, right?
Yeah. When the sun goes through your skin, you produce the vitamin D3.
Okay, and so the supplement, as you mentioned, it would have to be vitamin D3.
Vitamin D3.
And what is the indication as far as how much of it to take, or what to look for on the bottle?
Well, you want to at least get about 2,000 international units of vitamin D. You can go anywhere from 2,000 up to 10,000.
Okay.
Now you've heard you get toxic levels for vitamin D. I ask you real quick though, if you get 20,000 international units with 20 minutes of sunlight and you're not toxic, how could you get toxic through supplement form?
Well, as you said earlier, our body's extremely intelligent, and so it won't retain at that level to create this toxic. And
I think there's only been one study actually done where a patient was taking 300,000 international units by mistake, felt a little nauseous, stomach ache. They realized what the problem was. They brought down the vitamin D to the correct dose. He was perfectly fine.
Perfect. Okay, so anything else you want to add as far as the supplementation? Obviously, our best source is the sun and our food, right?
On that note, on the supplement, vitamin D3, it's the best way is to get it in a gel cap and make sure it's got the correct oil, because this is vitamin D is a fat-soluble vitamin. So make sure that the capsule has either olive oil, avocado oil, or coconut oil. So
if you don't mind, explain a little bit. What does fat-soluble mean?
Fat soluble means that it's crucial that you have fat in the intestine, in the gut, to be able to absorb the vitamin. And not only vitamin D, but vitamin A, E, and K as well. So
when we're getting it from the sun, how is our body helping us absorb it if it's not from the oil in the little capsules?
Through the skin, the cholesterol. The cholesterol with the UVB rays converts it into vitamin D.
Great. Wow. So that's very interesting. And so, what are some of the symptoms of low vitamin D? Okay.
Now, some of these symptoms may be a little subtle, so you may not know, because some of these symptoms can also be linked to other things. One of them is fatigue. You'll feel fatigued when your vitamin D is low. Another one is slow wound healing. If you see that you're taking long for your wounds to heal, that can be a sign that you're low in vitamin D. Also, depression. Depressed mood is also linked to low vitamin D levels. Bone pain, which is osteomalacia. It's kind of like your signal, your bone saying, I need more vitamin D, so you'll feel bone pain.
And so many people associate that with lack of calcium, right?
Correct. Now, again, yes, you need vitamin D to get the calcium absorption into your bones. You may associate it with calcium, but it's most likely vitamin D deficiency.
Okay, very good. And so you said something about the symptoms, the low levels. So how can we test to identify if we're low, if we're where we're
Correct.
at, or if we need anything additional?
Now, I will admit that probably about 5 years ago, I wasn't checking for vitamin D.
As a provider.
As a
right?
provider, I wasn't checking. I didn't know the importance. Well, I wasn't taught that we needed to check vitamin D in school. So it is a test that your medical provider doctor can order for you. I usually recommend to get your levels tested 2 to 3 times a year to make sure you're in that sweet spot, 40 to 75 nanograms per milliliter. But you have to get the right test. It's a 25 OHD is the test. Some doctors will check vitamin D 1,25, and that's not the correct test. You want the 25 OHD.
Okay.
So you can go to your medical provider and get that test and see where your levels are at.
And I will link that in case you guys missed it, just so that we can clearly identify what the exact test is that we should be asking our medical providers for.
Correct. Now, I'll just add on that the importance of vitamin D. Vitamin D is actually a marker of poor health. If you have low vitamin D, that's associated with poor health, also early disease and early death.
Wow.
Some of the factors in low vitamin D are patients who have metabolic dysfunction or insulin resistance.
Wow.
What happens is if you're insulin resistant, you have high sugar levels as well, that will deplete your body of vitamin D. So you can take the best supplement in the world, vitamin D. If you are insulin resistant, that you won't be able to retain that vitamin D in your body. Also, in chronically inflamed patients, you also have low vitamin D. Chronic inflammation also linked with sugar or diabetes, and hyperinsulinemia, which also triggers inflammation.
Right.
So that's why you'll see a lot of patients with low vitamin D have the chronic illness. So we got to fix that, because if we don't fix that, we will be constantly having that deficiency.
It seems like this vitamin D is essential for our optimal health, right?
Yes.
And we don't want to make these videos extra long, but we will follow up with additional information, more specific to immunology, how to
Correct.
create that optimal health, and maybe you will speak further on your channel about vitamin D and all the processes it actually benefits
Correct.
us, or where it works. But what would be 5 key points or takeaways that you would want to give the viewers? And of course, go ahead and say what you want to add to before the key
Correct.
takeaway points.
Important thing, you have control of your vitamin D level, basically. Get your sun, very important. Eat the right foods, eat whole foods. Take a supplement during the winter time, and fix your metabolic health. And that's the problem that we're having now here across the world. Poor metabolic health, insulin resistance. We need to fix that. Because if we don't fix that, it doesn't matter what vitamin D we take or how much sun we get. We're just not going to be able to improve or get that vitamin D to use it. One quick thing, magnesium. We need to get magnesium as well. And a lot of people, about 50% of people are also low on magnesium, and that helps activate vitamin D.
Okay.
And also, I recommend to take the vitamin K2 as well with the vitamin D.
Together.
So basically, and those are fat solubles. So basically, they all go hand in hand.
All right.
So that's why it's important to get those nutrients as well. Now, you can get all these nutrients through animal foods. So you can get all this through your diet, but you can also not get it if you're eating the wrong
foods.
Especially processed.
Right, and we will talk in further, length about a healthier diet, the type of diet that would, increase your optimal health and well-being.
Correct, yeah.
Which may be controversial for some people, but, that's okay. Even this vitamin D conversation can be controversial because
I don't see why.
It's not, and it shouldn't.
It shouldn't be.
Because it's basically free, right? Vitamin D is free.
Maybe that's why we don't talk about it. There's no money to be made here.
Oops.
That's probably what it is.
So our goal is to bring you information that is going to help you in your family's health and well-being, to encourage you to be your own advocate when you're with your medical provider.
Yes.
There should be no reason why you shouldn't ask questions or clarifying questions, or if you learn something, to go and ask.
Absolutely, yeah.
Right?
Take this video if you want to. Take to your provider.
So that is our main goal with the information that we provide, is to inform you, to help guide you, and to learn further on certain topics or things, that maybe you guys have questions on. Anything else you'd like to add?
Just I want to make sure the audience really understands this. We have control over that vitamin D, and we and linked to our immune health, we have control. I know they haven't talked about this at all on the news or on,
it's been very limited.
Limited at best. I think they haven't said anything about it, but you could take control of your immune health, and with making these changes, understanding how important vitamin D is, so you can have an optimal outcome if you do get the coronavirus or any other disease. So I just want your audience to really know it's very important.
Well, thank you so much for your time, and thank you all for viewing. And I will also have this video in Spanish for those of you that would like to share this video with any friends or family that are Spanish speaking. This will also be in Spanish available to you. And please visit Joel on his channel. He is going to have a plethora of information that is probably going to blow your minds. But yes, please like and subscribe, and I will continue sharing information with you. Bye.